Welcome to the MamasteFit YouTube channel. My name is Gina. I'm a perinatal fitness trainer, birth doula, and mama for, and I'm currently training for a marathon. So I want to share my runner accessory work that I would highly recommend that you incorporate within your workout routine, whether you're pregnant or you're postpartum, but especially if you are getting into running. In this workout, we're going to be focusing a lot on rotation of the rib cage, which is huge to helping with hip extension, with helping to improve running form. It can really help to alleviate a lot of discomforts that you may be having both during pregnancy and in the postpartum. For part one of today's workout, we're going to do some thoracic mobility with a resistance band. So I have a long looped band here. You can use whatever works for you. You can also completely omit the band as well. For part two of today's workout, we're going to need a band that's attached to an anchor point. Again, you can omit this altogether as well. And you will want one light to medium weight to utilize for the workout as well. So once you've gathered your long bands, if you're going to use them, in addition to one medium weight, I'll go ahead and meet you down on the floor to start today's thoracic mobility and runner rotation focus accessory work. So we'll go ahead and start down in a tabletop position. And if you're using a band, you're going to take it and place it around your rib cage area. And we're going to start by moving through some pelvic tilt. So your rib cage can move in three directions, and maintaining good thoracic mobility is really important for your overall comfort. The thoracic spine is meant to be able to have great mobility. And if we're restricted in this area, which can commonly happen during pregnancy, during the postpartum, it can cause more issues in like neck or shoulder pain, cause more lower back pain. So we're going to start today's workout with some front to back spinal mobility. And we're using the band to give us just a little bit of feedback to find a little bit more of a rounded position. A lot of us tend to favor a little bit more extension or arch in the back. And so we're adding that feedback so we can have some more rounding. In about 10 seconds, we're going to move to the rotational exercise. We're going to come to a half lunge position. Go ahead and step the left foot forward, hold the bands in your hand, and we're going to row as we twist towards that left leg. Come forward. Just kind of twisting in the spine. If you're having any discomfort here or you're feeling a little sticky in the rotation, think just slightly tuck that butt underneath. And you can also think like that bottom part of your rib cage is kind of sinking inwards. So the other movement that your thoracic spine can make or your rib cage is going to be the rotation. So we had the front to back movement or that flexion and extension, and now we're working on the rotation aspect of it. In about 5 seconds, we'll place that band on that thigh, and we're going to come into a side body opener. So now place that band down. We're going to think tuck the hips underneath and then push them forward. Reach that same arm overhead. So for you, it'll be the right side. And then we're going to lean away. So feeling this really big side body opener here. So again, hips are tucked underneath, pushing them forward so we're not arching in the back. Reach up overhead to feel this big side body opener. The third way that your thoracic spine can move is with lateral bending or extension. For a lot of us, when we think about thoracic mobility, we may forget the side body opening. And then we're going to switch to that other side here in a moment. Go ahead and bring the right leg forward, left knee is down, and then we're going to row as we twist. And then same thing, maybe we slightly tuck the butt underneath and then row. So if you're feeling pretty stiff, especially like in the back area, increasing thoracic mobility can really help to alleviate a lot of discomfort that you may be having. And being able to rotate as you run is incredibly important for a running form as well. Now go ahead and tuck that left hip under, push it forward, reach that left arm overhead, and then lean away for that side body opener. And then again, really tuck that hip under. So we got a little bit of front pelvic stretch here, or front hip stretch in that hip flexor, big side body opener. And then again, a lot of us tend to neglect the side body opening when it comes to thoracic mobility. And so this is incredibly helpful to incorporate, even if you just kind of like reach and make like a little banana with your body, incredibly beneficial. Keep that hip tucked underneath. Reach up just a little bit more. After this, we're going to go ahead and grab onto our weight to move through our lateral hip shifts. All right, come to a standing position now. For the lateral hip shift, we're going to need that light to medium weight. You can also do this without any weight as well. We're going to do 2 rounds total. So the second round, you may want to add in the weight, or you may want to do this with no weight the entire time. We're going to start with feet a little bit wider than hip distance, and we're going to think rotate belly towards one thigh as you straighten the other leg. So reach for the toes. You should feel a big stretch in the inner thigh, maybe a little bit of a stretch in that glute, and then switch to the other side. So we're just shifting our weight from leg to leg. We're kind of pushing the hips back to find this shift. And again, belly is rotating towards that bent leg, so you're going to feel a stretch here in this glute. So as you shift, adductor stretch, glute stretch, and then shift to the other side. And then we can add that weight, which is going to kind of pull us a little bit deeper into it. And then think lots of weight in the big toes. So we've got thoracic rotation here because we're reaching to the floor. And we've got rotation in the hips as well. Go ahead and place that weight down. And now I want you to grab on to that band. Again, you can omit it altogether. We're going to come into this 90-90 position. So my left leg is in front, right leg is behind. And I'm going to hold the band in my right hand. We're going to start by reaching forward over the left leg. And then row to twist. And then come forward. So we find a rotation towards that front leg glute stretch. Row. Rotate to the back hip, maybe a little bit more of an inner thigh groin stretch. So we're just kind of alternating between the two. Adding the resistance helps to bring you a little bit deeper into these movements as well. But again, you can do this without the band. If you don't have the attachment set up, if you don't want to use a band. If you have a cable machine, you can use a cable machine instead of a band as well. But we're thinking reach over the front leg, more of a glute stretch, sit back into that right hip as I row and twist. Get ready to switch to the other side. So bands in left hand, right leg in front, left leg behind. Reach. And then row to sit into that left hip. And you might find that one side feels a little bit more awkward to sit in. So for me, my left leg behind and my right leg forward feels a little bit more funky. It doesn't feel quite as natural to sit in. For a lot of us, we have really normal asymmetry within our pelvis, where left hip tends to sit more forward and right hip tends to sit more backwards. And so it's easier to find external rotation on the left a little bit easier to find internal rotation on the right. And so when we bring the hips into the opposite, sometimes it's a little bit more awkward. Go ahead and release that band and grab on to your weight. It can be the same one you did for the hip shifts or a different one. I'm just going to use a dumbbell instead. And we're going to start on our back. So my left leg is going to be in this 90-degree position, and I'm holding the weight in my left arm. Press it up to the ceiling, and then I'm going to bring my left leg to the other side as I press the weight up. Come back. And then twist as I press the weight up. And so we're just kind of alternating between these two. So we have rotation in the spine happening, but we're also really emphasizing scapula or shoulder blade movement. So by pressing the weight up to the ceiling, it's causing my shoulder blade to glide better on the back of my rib cage. And we have a little bit of weight here to really emphasize its movement. So whenever I have like neck or shoulder pain, this is like the one exercise that I will do because it really helps to alleviate it. Sometimes that shoulder and neck pain can be because there's a lack of movement in your shoulder blade. Let's go ahead and switch sides. So weight's in the right hand, right leg is up in that 90 degree. Bring that right knee down and then press the weight up to the ceiling. So we're twisting in the hips to bring it over as I press that weight up straight to the ceiling. And if you're not really feeling a whole ton in the shoulder blade, sometimes you need a heavier weight. So if the weight is too light, you may not feel it quite as much, like with the mobility, but it's okay to do a lighter weight as well. Go ahead and place that weight down. Let's come to a standing position to do our second round with that lateral hip shift. Now again, if you didn't use weight the first time, feel free to add on some weight this time. If you used weight last time, go ahead and grab it again. We're gonna reach for one foot as we twist and then switch to the other leg. So we're reaching towards the foot of the bent leg and hips are back. So we're kind of hinging here. So I'm not straight up and down. And then twist. And then I want you to think about lots of weight in both big toes. So as I come, I'm not flailing to the outside of that foot. So as you lower the weight down, really think about twisting in that spine so belly is coming more towards that thigh. And then keep lots of weight in those big toes. So we don't want to come on the edge of the feet. Go ahead, place that weight down. Let's come to the floor for the 90-90 row. So left leg in front, right leg behind. I'm going to hold the band in my right hand. So choke up on the band if you need. If you have a cable machine, you can use that as well. We're going to start by reaching over to bring belly towards that left leg. And then exhale, sit up and row as you sit back more into that right hip. And then really think about twisting in the spine here. Come forward and then come up to rotate and twist. Think about keeping that left knee down as you come up as well. So again, adding on the resistance with the weights and with the band can help you bring you a little bit deeper into these rotational movements. And as you sit up, really think about trying to be even as best you can between the two hips. So left knee staying down, right knee stays down as you kind of rotate and then come forward for a little bit more of that glute stretch. Let's switch sides. Right leg in front, left leg behind. And again, one side may feel a little bit more awkward for you compared to the other. You may have a harder time kind of keeping weight even. So as you come back, think right knee stays down, left knee is down. We're rowing and twisting, and then come back. And points that feel more sticky, maybe we spend just a little bit more time kind of trying to settle into that spot and then move. In about 10 seconds, we're going to shift to the final exercise with the rotational press. Go ahead and release that band and then come on to your back with your weight. And so again, we're going to start with the left side. I'm going to place my left foot down into the floor, and then my arm is going to be down on the floor as well. So we're going to press that weight up to the ceiling, and then we're going to kind of crunch up a little bit as we twist. If you want to bring the left knee to the opposite side, you can. And then come back down. Again, keep that foot down, press the weight up, and then you can lift to press and twist. If that feels like too many steps for you, just keep the weight up and then do the same one that we did from the first round, where you're just pressing it up towards the ceiling, but keeping that arm straight. If you want to add in the floor press, we'll press, lift the foot, and then twist. Keeping the foot down on the floor when you press just gives you a little bit more stability. Otherwise, you're kind of flailing around during that initial press. Let's go ahead and switch sides. So again, if you're pressing, keep the right foot down, then lift it, and then press to the ceiling as you twist. Go ahead and place that weight down, and this concludes our runner accessory mobility work. So with this workout, we're focusing a lot on rotation while adding in some load, which is going to help you come a little bit deeper into many of these movements. So you can add these into the end of your workouts. You can incorporate them into your lifting workouts. But if you want a more step-by-step approach to return to running in the postpartum timeframe, check out our online postpartum return to running program. It starts from the early days postpartum with our free recovery course, where it includes breathing exercises, gentle mobility, some gentle core exercises. And then we progress you into our Return to Foundations program, which is going to begin that rebuilding process. So we're incorporating strength training in a really supportive way and really gradually building you back until we return to impact, we can return to running and feel strong as you do it. So you can check out all of our postpartum programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And then if you want more workouts like this, be sure to subscribe to our YouTube channel. We'll release a new workout every Tuesday for pregnancy, birth preparation, and then to support you in the postpartum.